Hi, I'm here with Carol. Carol was in our clinical trial in Toronto using HIFU. So, Carol, I would like you to tell me your experience that you had in the clinical study here.
Well, prior to having the clinical studies, I had received the traditional treatment towards relieving the discomfort in my back. There were many times when it was fairly good, never perfect, and it didn't work immediately. It was kind of a gradual thing over weeks. Then when I participated in the clinical studies, I knew the whole procedure was explained to me, which was quite different than originally what I had had. So I wasn't sure what to expect. My hopes were that it would be perfect, and so it wasn't the least. I mean, it was a little uncomfortable, but nothing major. And so the procedure was done, and there was no immediate relief from the pain. So I anticipated that over the coming weeks, I would hopefully notice a reduction in the pain level. And it was very gradual, and it was kind of like I would move and go, oh, that doesn't hurt. Oh my, I'm feeling really. It was kind of moments of delightful surprise, and it lasted a long time, so that I was quite pleased with the procedure. And I didn't have needles poked into me other than just an IV. I didn't have a lot of poking around. It was just more of manipulating position, lined up, that was it, and then they count down. And it's like, okay, it's done. And so the prep time was a lot shorter than traditional. So, I was really, really happy with it.
Great. So, how was being in the study? Did you enjoy being in the study?
It was the first time I was ever in a study. So I had watched studies being done, but I was never a participant. So I was kind of curious, and I wasn't really sure what it was like being sort of like the guinea pig. But it was really quite easy. I mean, everybody was professional. They were really just very supportive of the whole thing. So I found it to be an enjoyable experience.
Great. So you talked a little bit about the RFA procedure versus the HIFU procedure. Give me just a couple little quick reminders of what the differences in the technologies were from your standpoint.
First of all, you have needles. They image you up under ultrasound, and then they insert needles in the appropriate places that they designate. And having the needles shoved in is kind of like, you're aware you're getting a needle. I mean, they give you xylocaine, but it's still, xylocaine stings, needles hurt. And then the procedure is kind of like, oh, you feel it. I mean, even with IV sedation, you still feel it, but it's very short term. I mean, it's not like, and then once it's over, the recovery is like you go and sit in a chair or a gurney, and that's it.
So how was the HIFU procedure?
There was very little discomfort. I mean, it was seemed to be shorter. First of all, you didn't have the needles going in, so they didn't hurt. And it was just a lot more comfortable. And because it's not invasive, I mean, you don't have people poking at you too much. I mean, they're manipulating your position, but that's it. And so it was just an overall much easier experience.
Did you find you have, do you think you would have more anxiety going into one procedure versus the other?
No, not for me, because for a couple of things. I have a nursing background, so I'm familiar with equipment, procedures, things like that. Plus, I was also familiar with the initial procedure because I've seen it done on horses. Not that I'm comparing myself to a horse, but I knew that what it actually entailed.
Okay.
And the thought of having an electrical charge trying to fry a nerve was, oh, well, there wasn't an option. This one, the second type of procedure, there was no anxiety at all. The explanations were very straightforward. And I think that made a big difference. Even with both procedures, the staff were very straightforward, very good with their explanations, and they weren't talking down to somebody like they don't know what's going on, but they made you feel like you really were a participant. You weren't just a body sitting on a stretcher. So there was no anxiety whatsoever.
So you're here in the office today for a HIFU procedure.
Yes.
Tell me what you expect out of today's procedure.
Based on the initial study procedure, I don't expect to have any relief at this point. But I do anticipate a gradual reduction in the pain over the coming weeks so that I'll have my moments of delightful surprise. Being totally pain-free, I don't know whether that's ever going to be a goal. But what I had initially wanted was pain management, a lot more comfortable pain management, so that it wasn't quite as disruptive to my overall well-being.
So how did your daily life change after you had the procedure? Were you able to get out more? Were you more involved? How did things change for you?
I was a lot more comfortable when I did go out. And because I wasn't battling the same levels of pain, my fatigue levels were a lot less. I didn't have to wake up so frequently in the middle of the night to readjust my position because I was having pain. It just made that I think the word would be, it provided me with a lot more freedom, and it gave me options. Like if I decided I wanted to do something or I didn't want to do something, that was my choice. It wasn't my back's problem.
Yeah, that's great. Is there anything else you want to talk about?
No, I'm just excited about having this done officially.
Yes.
And yeah, I can't say enough about it. I mean, when I tell people about there's options, it's like they can't believe other than take a pill. And for me, that's not an option. I try and stay away from narcotics, try and stay away from pain pills, because it's not taking care of the problem. So I just want to have a lot more comfort.
Great. All right. Thank you so much, Carol. It's
Thank
nice
you.
talking to you.